Aloha, this is Dr. Danto. I've recently had patients at the clinic who are experiencing groin, hip, or back pain and have previously had a hip or knee replacement. In this video, we will describe how to stretch and retrain the lateral muscles of stabilization and locomotion for the lower extremities as a part of an exercise prescription for people who fit this description. Please remember that before beginning an exercise rehabilitation program after a hip or knee replacement, that you need to be cleared by the surgeon to begin the program. Additionally, if you have a PT that is working with you, then you should discuss these exercises with them before implementing them on your own. A big part of the reason for the pain after surgery is the muscle imbalance or compensations that contributed to the need for the surgery or that may have developed due to limitations in motion resulting from the artificial joint or joints. When I say muscle imbalance in this case, I'm referring to tight lower extremity adductor muscles that pull the leg towards the joint attempting to protect it. The tight adductor muscles send a neurologic signal to the main muscles responsible for lateral motion of the leg away from the midline of the body, which is called abduction or abduction. These main abductors are called the gluteus medius and minimus. So one group of muscles add or adduct the leg to the body and the other subtracts or abducts it away. The gluteus medius and minimus are active when we are walking as lateral stabilizers. The main muscle that is supposed to be active when we are standing still is the tensor fasciae latae, also known as the TFL. When people have this muscle imbalance, the TFL becomes the main lateral stabilizer during walking, which is a setup for trouble. The trouble may manifest as hip pain, leg pain, lower back pain, or any combination of the three. It may even contribute to the development of pain in other regions of the body as the biomechanical nightmare results in stresses and strains affecting any old injury or chink in the person's metaphorical armor that is composed by the neuromusculoskeletal system. The first stretch that I'd like to teach you is a standing groin stretch. It is usually best to do this stretch near a wall, table, or a doorway so you can hold on to something if you begin to feel unstable. With this stretch, we start standing with our feet about shoulder width apart. Then move one foot about 1.5 to 2 shoulder breadths away from the other. Go only as far as you feel stable. Then turn one foot out about 90 degrees and lean in that direction to shift your weight and allowing your knee on that side to align over your ankle. While performing this stretch, try to contract your gluteal muscles. Hold this position for 30 seconds or 4 to 6 deep breaths. You will usually feel this stretch in the groin of the affected leg. Return to your starting position and repeat it on the other side. You can perform 2 to 3 sets of this on each side a couple of times a day. The next stretch that I'd like to teach you is the standing tensor fasciae latae or TFL stretch. Again, it is usually best to do this near a wall, table, or in a doorway so you can hold on to something if you begin to feel unstable. With this stretch, we start standing with our feet about shoulder width apart and turned out just a bit from one another. Then take a small step, placing one foot comfortably in front of the other and crossing it over the other side. Go only as far as you feel stable. Reach up with the hand on the side of your leg that's behind you and reach towards the opposite side with your palm rotated towards the ceiling. You may place your other hand on your hip or use it to stabilize your body by holding onto the door frame or a wall. While performing this stretch, try to contract your gluteal muscles. Hold this position for 30 seconds or 4 to 6 deep breaths. Return to your start position and repeat it on the other side. You can perform 2 to 3 sets of this on each side a couple of times a day. To retrain and strengthen your gluteus minimus and medius, the first level may be done sideline with your head supported by a pillow or your arm and your hips and knees bent at least 40 degrees. This exercise is often called the clam exercise because you open your knees apart while keeping your toes together, which looks like a little clamshell opening. If you find the point of your hip bone on the front of your body and place your thumb about an inch below it and lateral to it, then your thumb will be resting on the TFL. If you reach back with the rest of your finger pads towards your buttock, then they may rest upon your gluteus minimus and medius. When you open the clam about 10 to 18 inches apart, you should feel the gluteus muscles working to perform this motion. If it feels like it's all TFL, then you may adapt a strategy of tapping or lightly spanking the buttock muscles to activate the nerves and increase the blood flow in the area. It may be helpful to inhale while opening the clam and exhale while closing the clam. Repeat this open and close motion 8 to 12 times, then roll over and perform it on the other side. Perform 2 to 3 sets of this exercise on either side, pending muscle fatigue. Remember that when you're doing this, you don't have to go a big distance. You can only, if you can only feel comfortable doing 6 inches, just do 6 inches. You don't have to open the clam way up. The next level of training and strengthening your gluteus minimus and medius is again performed sideline with your head supported by a pillow or your arm. You should do this exercise only once. You can do the other one 3 sets of 8 to 10 in a row, and you're not terribly fatigued in the gluteus medius and minimus muscles. So you probably won't be able to do this the first time you set out to do it, and it may take weeks before you get there. This time, your bottom leg is the only one bent at the hip and knee for stability. You may again monitor the muscles by finding the point of the hip bone on the front of your body and placing your thumb about an inch below and lateral to it. Then your thumb will be resting on the tensor fasciae latae or TFL. If you reach back with your rest of your finger pads towards your buttocks, then you will rest them upon your gluteus medius and minimus. Point your toe down and twist your leg at your hip inwards, just enough to feel the muscles of your gluteus under your finger pads twitch. If it feels like they're not contracting, then you may adapt the strategy of tapping or lightly spanking the buttock muscles to activate the nerves and increase blood flow in that area. Then raise your leg about 6 to 12 inches, and you should feel the gluteus muscles working to perform the motion. Make sure you keep that internal rotation of the leg during the whole motion. It doesn't have to be a huge internal rotation, but you don't want to externally rotate it. It may be helpful to exhale while performing this motion and inhaling while lowering it. Repeat this motion 8 to 12 times, then carefully roll over and perform it on the other side. Perform 2 to 3 sets of this exercise on each side, pending muscle fatigue. Finally, I'd recommend starting and ending each day with these exercises, or at least the ones that feel comfortable to perform. Also, performing them before any activity or exercise that you've experienced discomfort from is a good idea. Lastly, if you are having discomfort performing these exercises or find them extremely difficult to perform, please cease trying to use them and talk to your healthcare provider. Thanks for hanging out with me and learning this exercise prescription. It is infinitely harder to do something or try something new than doing nothing. Keep moving, keep growing, and remember, at the Danto Osteopathic Clinic, we strive to normalize, optimize, and thrive. Best of health to you.